There you go.
Good, you?
I will. No.
Okay, we're live.
Simon, I'd like to open the Board of Commissioners meeting dated May 4th, 2021, starting right now at 1 p.m. Before we have prayer by Commissioner Joel Wyatt and our pledge by Commissioner John Block, I would like to read the following information in regards to Zoom meetings. Participants can join the Zoom meeting using the following instructions. Log into www.zoom.us. Enter meeting ID number 977-6119-6006 or dial either the numbers below 1-312-626-6799 or 1-646-558-8656. And again, enter meeting number ID number 977-6119-6006. And then press pound and then press pound once again. And so at this time, we're going to have a pledge by Commissioner Joel Wyatt and our prayer by Commissioner John Block.
Lord in heaven, we thank you for the opportunity to gather again to issue governance for the county of Sanilac. We ask that we would be forgiven of our sins as we go forward in order to do justice to our constituents and those that we live with. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Wyatt, Commissioner Block. Moving on in our agenda, next on our agenda is roll call. Denise, if you go ahead and do that, please.
District 1, Commissioner John Block.
Here.
District 3, Commissioner Bill Sartella.
Here.
District 4, Commissioner Roger Ballard.
Present.
District 5, Commissioner Joel Wyatt.
Here.
District 2, Chairman Gary Hubler.
Present. Thank you, Denise. Next on our agenda is additions, deletions to our agenda. Our agenda is going to be amended by one addition. And under new business, when we get to our FAs and NFAs, the last addition, one and only addition is going to be NFA 023-21 of that with Commissioner Block, and that'll be the last one on the new business. So at this time, I will entertain a motion for the adoption amendment of our agenda today.
I'll make that motion.
Support. Okay. Been moved and supported. Any discussion? All in favor, say aye.
Aye.
All opposed, the same. Motion passed with the amended agenda today. Next on our agenda is our meeting minutes from April 20, 2021. I assume everyone's had a chance to review them. And at this time, I'll ask for approval of minutes for April 20, 2021.
So moved.
There's been a motion made and support for approval of minutes for April 20, 2021. Any further discussion, questions, revisions? Hearing none, all in favor say aye.
Aye.
All opposed, the same. Minutes of 2008 of 2020. 21. Next on our agenda is Commissioner's report, and Commissioner Block, I'll start with you.
I don't have anything in my commissioner's report, but I will have some committee reports later.
Bill, you want to do next?
Just quickly, Village of Lexington has started their DNR phase 1. So their boat launch there is going to be out of commission for a while. And then they're going to be moving into phase 2, which will be the bathhouse and the offices at the DNR site, along with their dockage, which will be part of phase 3. And then the village hopes to incorporate the phase 3 side with the gas stocks and so forth into their village park as well. So if they're having construction there for that, they might be able to take care of the entire lakefront at the same time. that's it for commissioner report for me.
Thank you. Roger?
I really don't have anything other than if you're traveling south on 53, I recommend you don't.
Yeah, my wife made that mistake of going that way.
So did
I
I.
got her at the airport the other day.
Yeah, it's going to be a summer-long project, but it'll be nice when it's done.
Joel?
So Worth Township was in the paper recently actually a couple weeks ago about the recycling bin. Had a conversation with Joanne By regarding that recycling bin. There's an opportunity if we are able to find another location for it. It was discussed possibly that she would contact Commissioner Sarkello about it for some opportunities he may have. And that's all I have.
Okay, thank you, Commissioner. Well, I have nothing to add for Commissioner reports at this time. When we get to committee reports, possibly Joe and I will talk about some things that we've been involved with in committees. Tara?
Just a couple things to note. We have a scrap tire collection event on Wednesday, May 19th from 2 to 6 at the fairgrounds. So there is a flyer on the website if you're interested in that. Also, it was noted that NACO, which is the National Association of Counties, they're indicating that federal guidance on the ARPA funds or the American Recovery Plan Act funds should be released this week. So we're anxiously awaiting that information to see how it aligns with our planning that we've done so far. And then in addition, it's that time of the year again, we're starting the budget for 2022. So we've already started the budget in the administration department, and we'll be rolling out communications to staff within the next month. And health insurance, I know we talked a lot about that last week. We do have Brian Bellware on to give us a presentation today. I did send out a memo on Friday to communicate the changes, potential changes to the plan to staff. I think the biggest change that staff are looking at is just the change in the network from Priority Health to Aetna. And then the major change for the county would be instead of being fully insured, we would become self-insured. So we'll discuss that more in Brian's presentation. And that's all I have.
Okay, thank you, Tara.
Thank you.
Next on our agenda is public comments, agenda items only. Later on in our meeting, we'll have opened it up to public comments again that don't pertain to our agenda. So at this time, is there any public comments that pertain to our agenda? Seeing none. Next on our list, as Tara already talked about, we have a presentation by Gibson Insurance and Brian Beller. So Brian, I assume there you are. Yep. You have the floor, my friend.
Good afternoon, everyone. It's good to see everyone virtually, at least. So we are really excited about what's in front of Sanilac County from a healthcare standpoint. So wanted to walk you through a few just highlights of not only the outcomes and strategies that we're recommending, but also just a little bit about the process, because we've taken a very diligent process at evaluating making a transition from fully insured to self-insured. And so want to just walk through that a little bit and then just be a resource to answer any questions. I know Tara and Jody have done a great job of keeping everybody in the loop as we've gone through this process, and so just want to be a resource for you all today. So let me start with Priority Health and your fully insured plan. We received a renewal earlier this spring from Priority Health with a recommended 5.58% increase to your fully insured rates. And so that, number one, was a good sign for us because essentially what's called in the industry a trend increase. So medical cost inflation typically drives carriers, with anywhere from 4 to 6% baseline trend increase. And so what that suggested to us was when Priority Health underwriters were looking at your group, they saw what appeared to be a good risk. So they didn't see anything that was scary, where they wanted to price you guys out of their block of business. If we were looking at a 9, 10, 11% increase, or even higher, we're seeing in some cases, that would be a red flag to us. to go down a self-insured path. So the fact that we saw a moderate trend increase of a little over 5% was the first indicator that we really felt self-insuring could be a viable path. We then requested a self-insured proposal from Priority Health. So this is called an ASO, an Administrative Services Only. So it's self-insured through Priority Health. And that proposal was really attractive as well. So it represented a cost decrease and really gave us a glimpse into what the underwriters were looking at from a claim standpoint. So that was a very positive indicator. Sometimes carriers can play games though with pricing to retain the business, or in some cases to win new business. And so we always want to do an independent analysis. So with the renewal, all the claims reporting and the Priority Health proposal for self-insuring, we went to our independent third-party actuary partners called Wakely, and they did a self-insured feasibility analysis. That was also favorable for self-insuring. So really at this point, we've had 3 positive indicators that Sanilac County is a good candidate for self-insuring. We went out to market to look at stop-loss insurance. In a self-insured world, stop-loss is the insurance that you purchase to help protect your group against high-cost claimants. So stop-loss would kick in once a claimant hit $100,000. So in a self-insured environment, Sanilac County is going to pay claims up to $100,000, and then stop-loss insurance kicks in after that point. So any kind of high-cost claimant is going to be covered through stop-loss. Unfortunately, the independent stop-loss market was not competitive because Sanilac County had 2 or 3 high claimants that hit your plan over the past 12 months. One of those was a preemie baby that ended up being over $1 million claim. And then we had a couple other more moderate, couple $100,000 claimants. So what we did is we went and looked at some buying coalition types of models. A buying coalition is just putting you with other like-minded groups so that you can buy stop-loss insurance as a whole, as a group, instead of buying it individually. And so what that did was present Sanilac County not as a 160 life group, but as a 10,000 life group. And so we were able to get a couple competitive proposals on stop loss through those buying coalitions. Tara, Jody, and the team went through an interview process with the various different buying coalition models. And ultimately, we selected Pareto Health as the best fit, both from an administrative standpoint, with a network, Aetna, very competitive network in your region, and with the terms of the stop-loss contract. So the stop-loss contract that we're going to have through Pareto is actually the very best contract that's available in the country. In terms of it's providing a rate cap, it's providing protection against future high-cost claimants. If you were to have another preemie baby or a high-cost, ortho, heart disease, some of those types of high-cost things that can hit plans, you've got the very best protection through the contract that we've built for Sanilac County through Pareto Health. So that's a little bit about the process that we went through to evaluate your different options and to really land on the self-insured platform as the best fit for Sanilac County. Along with that, we've also gleaned insights in terms of where you have claims hitting your plan today that could be managed more effectively. And so we're building over the course of time, over the course of a multi-year strategy, we're building those different components into your health plan. One of the lowest hanging fruits that we saw was high-cost specialty drugs. One of those is Humira. So Humira is a specialty drug. It's used to treat rheumatoid arthritis, among other inflammatory types of diseases. And you actually have 2 claimants that have Humira, that are prescribed Humira. So that what that's costing your health plan today is about $80,000. With the new program that we're proposing we implement through Priority Health, we're actually going to be able to source that same exact Humira drug, same dosage. We're going to be able to source it directly from the manufacturer at no cost to Sanilac County and at no cost to your members. So that's just one example of the type of things that we can do in a self-insured environment to not only save cost, but to maintain, if not improve, the quality of benefits for your people. We're also going to engage with a care navigation platform called Quantum Health. Because you're going through the Pareto Health Buying Coalition, you actually have access to Quantum Health that you wouldn't have access to otherwise. Independently, Quantum Health only works with groups that are over 1,000 employees. And so because you're a part of the Pareto Health platform, you'll have access to that incredible care navigation platform. And they're going to be able to come in once we implement them, which we're planning to do in January. They're going to be able to come in and really bring a very strong care navigation support for your employees to help navigate the health system. So we're really excited about that. And what they project year 1 savings is anywhere from 5 to 6% on claims based on what they historically have achieved over the past 15, 20 years that they've been doing what they do. So we're super excited about the specialty med program. We're super excited about the care navigation. And then in year 2 and 3 and beyond, we're going to be able to continue to implement programs and strategies that really help drive high quality, affordable healthcare for your people. I wanted to circle back and just highlight one thing real quickly with the high claimant that I mentioned earlier. There was a preemie baby. It was about a $1.3 million claim. Based on the underwriting analysis that we've seen, we expect the bulk of that claim to have been paid under the fully insured plan. So while there will be some ongoing claims that are incurred under the self-insured plan, we expect the bulk of that claim to be paid under the fully insured. And there is some risk associated with that, but that's being factored into the pricing proposal. I'm sorry, if that was a question, I didn't catch it.
Nope, I think.
No one said anything.
Okay,
You
sorry.
might be getting static from out in the hallway. We have people waiting in the hallway because of COVID. Yeah.
Okay, perfect. So the other part of that I think is really important to note is that when Priority Health does your fully insured renewal, they're actually using an experience period that ends in October of the previous year. So that $1.3 million claim is not reflected in your fully insured renewal this year. If you were to stay fully insured for another year, it will be reflected in next year's renewal. Okay, and you can imagine how Priority Health would rate your group factoring in a $1.3 million claim. So that was, part of the, part of the consideration too with recommending that we move down a self-insured path. We're going to be able to mitigate the potential impact to your rates from that claimant. Couple things on Pareto Health that I just want to highlight. Again, it's a buying coalition. So Pareto Health brings together like-minded employers who want to proactively manage their healthcare costs and claims. And they are one of the largest buying coalitions in the nation. They have a strong track record of performance. And it's actually one of our preferred coalitions. Gibson's own health plan, and we've got about 150 employees. Our own health plan is a part of the Pareto group. Okay, so that's how much we believe in that model and the value proposition that they bring to the table. You're going to be able to access some of the very best strategies and programs that Pareto Health has brought together by being a part of their platform. So we're really excited about that, and we were glad to see that we were able to get a competitive proposal from them because we think that's a fantastic program to be a part of. So I started with Priority Health's 5.58% renewal. So to give you an idea of what we're projecting based on what we're seeing in claims right now, we're projecting a conservative about 4% decrease over your current cost. And then that equates to just shy of about a 10% decrease over your renewal rates of if you stay with Priority Health and are fully insured, it's about a 10% decrease. So, we do see this being a very competitive transition into self-insuring for year one, and then a lot of opportunity going forward into the future with some additional opportunities for cost savings in year two and beyond. So with that, let me pause and just turn it over to help answer any questions that you may have.
This is Chairman Heberling. I'll save my question to last. I'll let other commissioners, anyone else in the room ask questions, but it was good to hear that Sanilac County is a good candidate for this, and we appreciate, Brian, all the time you put into it as our administrator and Jody have done. This has been a long time coming. We've since I've been a commissioner, the last 2.5 terms, this insurance issue has been near and dear in everyone's heart, and I think I can speak for most of us. We really are fortunate to hit of Jody and Terry and yourself working on this, and it looks like some good news today. And as we move forward, hopefully we can talk some more and take advantage of this. So thank you. So, John, I guess I'll open up to anybody if you got questions.
Yeah, I've got a question. Brian, when we've gone down this road of self-insured and we find out that it may not be a good fit 10 years from now, what happens when an organization needs to go back to fully insured?
Yeah, that's a great question. So if you all determine that you need to move back into a fully insured capacity, it would be a matter of getting a fully insured quote. So, we would establish a fully insured carrier, to begin to cover your group effective, 7/1, assuming that's still the renewal date. And what would need to be managed is what's called the run out claims. So if we were several years down the road and there was a claim that hit in June, right, then that claim would not have been paid until July or maybe even August. And so there's a period of time, typically about 3 to maybe 6 months, where your self-insured plan would still incur some liability. And we would have it's called a terminal liability option, or TLO, that we would have built into your contract to help cover those run out claims. But then anything that would hit after 7/1 would hit under your fully insured plan.
What difficulties can we see having gone from fully insured to self-insured and then back again? I would imagine the parameters for getting a decent rate might be difficult. Is that a possibility?
It's always a possibility. It would just depend on what your claims are doing and where we have your cost structure at that point. The fully insured market, can be very competitive at times, and at times it can be a pretty hard market. So it would be tough to predict that. What I can tell you is that from our experience, if we are proactively managing claims and looking at things from a long-term perspective, typically groups are staying pretty consistent in the self-insured environment. So going back and forth is not typically something that we see often. If you were just buying a self-insured product through like a Priority Health or another carrier like that, and you weren't doing anything to actually manage claims, that becomes a little bit more of a likelihood. But with the way that we're proposing that, we're structuring your self-insured plan, we're being very deliberate on protecting your plan against high cost claimants, which in any environment is always what drives 80 to 90% of your cost. So with the spousal incentive program, with a specialty medication program, and then as we continue to build from there, we feel that we're building a very strong, high-performing health plan. So I would put the likelihood of moving back into a fully insured capacity at a very small likelihood. So does that help answer your question?
Yes.
Brian, this is Commissioner Block. I've got a question. Our current health plan doesn't include the whole family, and I think that's something that obviously everybody would like to see. Can you explain how going to self-insured may help us with that goal?
Of including the whole family?
Yeah, like what would that look like? Is that something that would be feasible moving this way?
Yeah, absolutely. So, I think one of the goals that we've been working towards since day one was trying to restore the family contribution to help make that more affordable. So, as we finalize, the approval to move forward with this and start to finalize the numbers from a premium equivalent standpoint, because what we'll do is we'll take the overall cost, and then our team will break that down and develop premiums for you, just like Priority Health is developed for you. We're going to do that on our end with our actuary partners. And so once we determine those premium equivalents, we'll be able to determine what that contribution can be relative to the hard cap and the overall budget. And so we certainly feel like we're going to be able to make some steps towards restoring that family contribution, and then continuing to offer coverage for families that need that coverage.
Thank you.
Any other questions for Brian?
I have a question. Brian, I'm Roger Ballard, District 4 Commissioner. Can our employees expect to be able to continue with their current care providers? Are there going to be any issues with that?
Yeah, that's a great question. So what I'll say is that as a part of the process of evaluating the different buying coalitions that we looked at, the network was a big part of that dialogue. And so the Aetna network is very competitive in your region. So we looked at all of the major health systems, hospitals, and facilities. We looked at the availability of primary care specialists, other types of providers, and the Aetna network was the most competitive and very comparable to what you have today. That said, anytime you make a change from a network standpoint, you can expect some changes. So there likely will be some providers that participate with Priority Health that don't with Aetna. And it would be the same thing if we went from Aetna to Priority Health and Blue Cross Blue Shield, any of the common networks. So I'm not going to promise you that there's going to be zero disruption, but what I can tell you is that the Aetna network is very strong, and there's a very good selection of providers and facilities. So I would expect the disruption to be minimal, but I can't promise zero disruption.
Thank you.
Brian, thanks again, and thank you for a very well prepared and in-depth presentation. For not only our commissioners, but for our constituents and our employees here are coming. That will move on. Thanks again.
Thank you.
We now have a presentation by our Community Health Authority, Will Morris.
Passing out is actually our annual submission. It's a document that's required by the state of Michigan that we compile every year. And historically, we come to the county commission to share this information. Last year, we were actually scheduled to do so, but because of COVID, we weren't able to do it. So we actually missed a year. So sorry about that. Can y'all hear me okay?
Yes.
Yeah. All right. Not typically a very loud spoken person, so I'll try my best here. So I wanted to just point out some highlights on this report that we submit to the state. On the first page, or what's in the second page of the packet, it talks about reports for requests for services and disposition of requests. It kind of looks like this. This kind of talks about how many individuals actually call community mental health in a given year for service. So on this particular fiscal year, which is from October 1st of 19 through September 30th of 20, we had 852 residents who contacted us for services. The important takeaway from that is actually down on number 12, and that's that 604 of those individuals actually met criteria and received services from Salem County Community Mental Health. And the line right below that, the 224 folks were actually in crisis mode, which means they needed to be seen on the same day. There's obviously a lot of other figures on here, but I'm just going to point out some of the highlights. The back side of that page actually is a wait list. About 10 years ago, the state dramatically cut our general fund, and as a result of that, we had to prioritize individuals as to whether or not they could or could not receive services. The important thing about this particular piece of paper or takeaway is that we have no one on our wait list, which means that anyone who comes in our door that qualifies for services gets services. We don't have anybody waiting until there's an open slot. So that's an important thing to actually show. On the next page, these are actually community needs assessments. These are all figures that are provided to us by either the state or others. It's kind of interesting to me. The state gives us numbers for us to then give back to the state. But that's how the state operates. But I think some of the important things you might want to look at is on number 2, it talks about Medicaid enrollees. In 2019, there were 7,300 residents with Medicaid. In 2020, it was 8,289. That's a dramatic increase. Obviously, that's probably directly related to COVID, but something you should pay attention to. Because if you look back, going back, from 2016, 17, and 18, 7,000s, and all of a sudden we had a dramatic increase. As well in Healthy Michigan, which is the line right below that, it also had a dramatic increase from 2,100 to 2,600. So that's an important figure to actually pay attention to. Another figure I always like to point out is at the very bottom, 5C. It talks about persons served with a developmental disability. And the state figures based on our population, we should be serving about 205 citizens with a developmental disability. We are in fact serving 332, way above what the state expectation is. I think that's an important figure to share as well. Then another one I wanted to always like to find out is number 19A. Talks about 89.94% of the individuals who receive services through mental health are tied in with a primary care physician. That kind of ties into our whole direction towards integrated care and trying to make sure that folks are getting both their behavioral health and their physical health needs met. 90% of our individuals are reporting that they do see their doctor. Which is pretty good because I don't think 90% of my staff see that. The last 2 pages are attachments. This is different. Typically, the state requires us to do a needs assessment, look at our community and what our important mental health needs are for our community. We talk to our stakeholders like the sheriff's office and hospitals and things like that and figure out what kinds of things and goals we have. But this year, the state decided that everything's kind of focused on COVID. What really are our priority needs and planned actions related to COVID. So as you can see, we had 5 primary goals through this period of time. First one, keeping our vulnerable individuals safe while providing medically necessary services. Not having adequate resources, staffing has become a massive issue. I'm sure it has for everybody, but being able to actually get qualified applicants to apply for jobs has become really, really hard over the pandemic. Not being enough PPE, and obviously the executive orders are seem to be changing all the time. I'm sure we follow them. That's pretty much my report in the gist, but I'll entertain questions if anybody has any specific.
Well, I have a couple things. One is you, and your totals that you're in page, with the second page. How many people met the eligibility criteria, and the next bracket was how many met emergency conditions criteria. And that's quite a number, and probably some of this has to do with COVID, as you got in the last page. It's affected everyone. I get that, you know. But the question I asked, when someone comes in, where do you draw the line where our county can address those, or people being sent out to specialized rehabilitation? Is there a breakdown of these people that?
Well, that 224 number is the number of folks we assess to determine if they need psychiatric hospitalization or.
Yeah, good, they're sent out then, yeah.
So, yeah, so if somebody requires psychiatric hospitalization, they're, Fort Huron Hospital, the Pier Hospital, or Saginaw, because we don't have a psychiatric facility in Sanilac County. Typically, everyone comes home, and we try to keep as many folks in the county as we can. We do have some individuals at the Pareto Center, some individuals over at the Forensic Center. And we have some individuals that we can't safely keep in our local communities because there's rules as far as what kinds of restrictions you can put on people's rights in our homes. So there are specific homes throughout the state that we have to utilize if there's too many safety concerns for them to stay here. In the hopes that, once we get their behavioral health issues managed, they come back. So, can I answer your question?
Yeah, it did. And, I think every one of us who sat here and we hear on the radio, we hear on TV, we see your reports and other people's reports. Joel and I said in the OE meetings, and obviously COVID has had an impact on everybody huge. And I know that probably a lot of your people walking your door has been because of COVID, because of depression.
Honestly, the average number of screenings has not gone up significantly because of COVID.
Oh, really?
One of the things that we provided early on, I think it was last April, I started a community line for individuals in the community just to be able to call if they wanted to talk to someone. And I brought it up at emergency management a couple of times, but it's not very well utilized. We advertise it on our Facebook page. We do not get a lot of just community members who call and say, I'd like to just talk to someone because I've had a bad day related to COVID, which we're willing to do. But the number, even over the course of a year, I doubt it's been more than 20 for that particular purpose. And those wouldn't actually be part of this count. These are folks that actually go through the access screening process and are actually sent to us for true mental health services, not just COVID-related mental health services. We have just recently applied for a block grant through the state, and we were funded to provide more COVID mental health related services. So I am hoping to be able to do like community drop-in groups and things like that, where anybody can just come in where a therapist would be available to talk to them. I hope it's more successful than our call line has been. That's why I mentioned on the emergency management, people could share. I think that's the right term. I use Facebook, so if I'm using the wrong term, I'm sure someone can correct me on that, but they'll get that information out there so that people in the community know that it's a resource for us. The only other thing I wanted to mention, just to put on your radar, is that unfortunately, in the middle of COVID, when we're all stretched out and trying to figure out how we're going to meet our resources, there was recently 2 proposals put forth in the legislature. Senator Shurtke and Representative Whiteford both put forth a proposal to actually privatize the mental health system. I don't know what that's going to look like if it passes. My concern has always been local control. The county commission chooses the board for the CMH mental health, and we have a lot of latitude to be able to provide services for the community Because each community is different. My biggest concern with privatization is turning the mental health system into a cookie cutter. So that mental health services in Sanilac County will have to look exactly like mental health services in Oakland County. If that can't happen.
Do you have the numbers of those bills?
Not handy, but once I
Okay.
get more information, I have a meeting next week. I'll share that information with you guys, especially if I would appreciate some reaching out or whatnot. Because obviously, I understand there's some inefficiencies and I'm all about eliminating inefficiencies. But I'm also all about maintaining the ability to have the flexibility to meet your local community needs.
What was his reasoning for putting this bill
His intent is to integrate behavioral and physical health, but to do it at the payer stream, not at the local level. So I guess it's a philosophical difference. To me, it improves people's lives if I sit down with the hospitals and the doctors and figure out a way that we can work together than it does for us both to get our checks from the same place. The disadvantage is the Michigan health plans have an administrative rate of 15%. PHPs have a administrative rate of 7.5%. So I don't know where that other 7.5 is going to come from. If it comes from services, that'll be the dramatic impact of the system. But it's not clear at this point. It literally was just sent out with the intent of passing it within 4 months, which is a very, very fast. Normally the legislature takes 2 to 3 years to do something. But I'll let you know as I get more information.
With staffing issues that you mentioned, has the Croswell facility continued to operate?
It is. The Croswell facility continues to operate, actually at a higher level than it has operated before the pandemic, which surprises me. Right now, because of the pandemic, we actually have a unique ability to provide services in lots of different ways. So I actually had some data pulled. Wasn't part of this presentation, but we're actually providing more service now than we were before COVID, because people can receive services, by Zoom, they can receive services by phone or face to face. While in the past, if someone missed the bus, didn't feel like coming in, wasn't feeling well, they would cancel. Now they just call, and we do it by Zoom or the phone, so we're able to still provide that service. So hopefully those rules don't change, because I think it's really dramatically improved access for folks. And honestly, other communities have seen dramatic increases in suicide and things related to COVID, and we haven't. And I don't know how much of that is tied to those things. But yeah, I don't see closing Croswell. People have told me that it's not closing. And honestly, if we get funded for CCBHC, we'll actually be Marlette and Brown City as well.
Great.
And we're definitely going to questions one day we'll quit now. Any other questions?
Well, thank you very much for your good information. And thank you for coming on in and
Okay, thank
sharing
you.
your update.
It's a day.
You too.
Moving on our agenda, appointments, planning committees, none, county commissioner appointments, none, county commission chair appointments, none. Number 15, general resolutions, we have 3. And Commissioner Block is going to share those with us in a moment. We'll vote on them. Resolution for fiscal year 2022 community corrections. And then there'll be a resolution support the state Michigan fulfill a state statute obligated regard to state revenue. And I was tipped off on that here 2-3 weeks ago. I immediately sent it on to our county controller and Commissioner Block. So that will be the last resolution we'll read. You want to go ahead?
And we got a third one too for the 4-year term too.
Yeah, sorry. Yep.
So I'll start with the first one. So resolution fiscal year 2022 community corrections grant application, whereas Sanilac County as a member of the Thumb Area Regional Community Corrections will appear in Tuscola counties, recognizes the need to offer felony probationers with specific programming targeted at further advancing offender success rates and reducing repeat offender rates. And whereas the fiscal year 2022 community corrections grant application written on behalf of the Thumb Area Regional Community Corrections will provide a funding source to incorporate such programming and administrative oversight in Sanilac County. Therefore, be it resolved that the Sanilac County Board of Commissioners hereby approves Sanilac County's participation in the Thumb Area Regional Community Corrections Fiscal Year 2022 Community Corrections Grant Application for the period of 10/1/21 through 9/30 of 22. Be it further resolved that this resolution be spread upon the proceedings of the Sanilac County Board of Commissioners this 4th day of May 2021.
Okay, there's been a motion and support for the resolution fiscal year 2022 community corrections grant application. Denise, this roll call.
Commissioner Sarcella,
Yes.
Commissioner Ballard,
Yes.
Commissioner Wyatt,
Yes.
Commissioner Black,
Yes.
and Chairman Huberly.
Yes. Motion passed. Next on our agenda is resolution support of the state of Michigan to fill its statutory obligations with regards to state revenue sharing payment amounts.
Whereas in 2005, state revenue sharing payments were discontinued to counties, relieving the state budget of $183 million in annual state revenue sharing payments to counties, with the promise and agreement that these payments would be restored when each of the individual counties' revenue sharing reserve fund were exhausted. Whereas Sanilac County's revenue sharing reserve fund was exhausted in 2010, and whereas the Michigan Association of Counties has identified 60 Michigan counties that have received less than the statutorily required amount of state revenue sharing since revenue sharing reserve funds were exhausted. And whereas the Michigan Association of Counties has identified a $806,909 cumulative shortfall in state revenue sharing payments to Sanilac County since 2010. And whereas the influx of American Rescue Plan funds to the state of Michigan, there are sufficient funds available to make counties whole with regard to state revenue sharing payment shortfalls. And whereas unlike Sanilac County's allocation from the American Rescue Plan, the payment of the state revenue sharing shortfall will not be restricted to COVID-19 related expenses, thereby making it eligible for critical infrastructure projects, pension fund or OPEB contributions, and other expenditures. Therefore, be it resolved that the Sanilac County Board of Commissioners does hereby support and urge the state of Michigan to fulfill its statutory obligations with regard to state revenue sharing payments for all 60 Michigan counties identified by the Michigan Association of Counties that receive less than their statutorily required amounts. Be it further resolved that the county clerk shall send copies of this resolution to the governor of the state of Michigan, the majority leader for the Michigan Senate, the speaker of the Michigan House of Representatives, and Sanilac County State Legislative Delegation for their consideration and action. Be it further resolved that this resolution be spread upon the proceedings of the Sanilac County Board of Commissioners this 4th day of May, 2021.
Support.
Okay, then a motion made and support of this resolution, and this is a big thing. And only by chance I received the email, I don't know, 3 weeks ago or so. As I said, I immediately contacted our finance chairman and chair. So any other questions regarding this resolution?
Commissioner Wyatt,
Yes.
Commissioner Ballard,
Yes.
Commissioner Sarcella,
Yes.
Commissioner Black,
Yes.
Chairman Huberly.
Yes. Motion passed. I know we've given you a lot to read here.
I might need a glass of water at some point. I can get to the last one, I think.
All right, if you want me to have someone else. read
Yeah,
it,
if somebody else would.
Okay, Joe, yeah, you want to go ahead?
Resolution in supporting passage of legislation to adopt 4-year terms for county commissioners. Whereas the 1963 Michigan Constitution, 4-year terms for the County Board of Supervisors, the preceding body to today's Board of Commissioners, and whereas the legislature voted in 1966 to abolish boards of supervisors and formally replace them with the Board of Commissioners after the 1968 election, and whereas Public Act 261 of 1966 promulgated the length of terms for the new county commissioners shall be concurrent with that of the state representatives as specified in Article 4, Section 3 of the Michigan Constitution. And whereas the scope of duties of a county commissioner has greatly increased in the last century, road patrols, indigent defense, mental health treatment, and substance abuse prevention programming, solid waste pickup and disposal, food and water supply, park operation, economic development efforts, emergency management and response, and whereas Michigan is one of only 5 states in the United States that provides for exclusively 2-year terms for county commissioners, and whereas all county, township, and elected officials in Michigan are elected to terms of at least 4 years, and whereas the position of county commissioner is a highly complex oversight role that requires years to master, and whereas legislation to amend state law to enact 4-year terms has been filed in the form of Senate Bills 242 and 245, and whereas the Michigan Association of Counties supports the legislation as introduced, therefore be it resolved, the Sanilac County supports Senate Bills 242 and 245 to enact 4-year terms for county commissioners. Be it further resolved that this resolution be spread upon the proceedings of the Sanilac County Board of Commissioners this 4th day of May, 2021.
Support. Okay, Madam, motion made and support for a resolution supporting passage of legislation to adopt 4-year term for county commissioners. Any further discussion or questions or input?
There's a minor typo in there where it says requires year to master. I believe that should be plural, correct?
Not for all of us.
Good point.
Who's taking down these amendments, changes?
Yeah, you read it yours and I changed it when
Okay.
you read it.
Also, behind, in the beginning, first paragraph, whereas the 1963, it should say the Michigan Constitution required, or we could call for 4-year terms. And then finally, in the second to last paragraph, it says the Sanilac County supports Senate bills. It should say Sanilac County Board of Commissioners. Thank you.
I applied to one of our local newspapers in the county. There's pros and cons of both sides of this, but I think this states it very well. On a 2-year term, you get elected, and after the first year, you start to run for the position again, and you may or may not get in. And I think all of you know that even the service commissioners over time, it takes a while to get a grasp on everything. And clearly here in our case, a 4-year term, I think our county would be better served if we had 4-year terms. And obviously Matt has already stated that in the decisions they made. Denise?
Commissioner Sartella,
Yes.
Commissioner Wyatt,
Yes.
Commissioner Black,
Yes.
Commissioner Ballard,
Yes.
Chairman Huber.
Yes. Motion passed. Okay, moving on, next is FA 075-21, approval of current claims.
Review committee reports.
Oh, I'm sorry. And I didn't see it on the agenda, but there's a communication, blue sheet here. That you need to go ahead and read. Committee report, sorry, I jumped ahead. I wasn't trying to shortcut here. Joel, let's start with you. Committee reports.
Committee reports. I'll let you handle it, Gary. Okay, none.
Okay, this morning, excuse me, we had a personnel meeting, and we went over 3 or 4, maybe 5 different requests from departments. The last one we had was the Parks Board, and we did make final decisions on everything, enough to bring recommendations to the board yet on a couple of them, and so we'll see that next meeting. Committee report.
I don't have anything. We are meeting, Parks are meeting tonight. And then next Friday, we have our first in-person meeting with Michigan Works over in Lapeer. So it'll be nice to get back to more live committee meetings.
Just want to update you, Jim Barman was here from the Parks and Recreation, and we talked about the clerk position and the maintenance
Yeah, I talked to Jim.
Okay, so we're gonna have a meeting later in the week to clarify and get job description, et cetera, but we didn't have today, so.
Several things. I'll try to keep it short. Some corrections board met last week and one of their suggestions was obviously to approve the resolution, which we just did. So that's a good thing. And then MAC 7 met last Friday. The MAC conference was this last week and also the ag and tourism. So I had several meetings that I was part of. Fortunately, Zoom allows us to do that. Heard Sean Carlson, the Oakland County Deputy Executive, talk about their COVID money staffing, but they also had a larger issue because they received $256 million. But it was interesting to see how they broke that down. One thing to be aware of too, if you haven't already seen what you get, MAC sends legislative updates every Friday. So there's some good information in there. As far as their take right now on the ARP money, they're suggesting keep your powder dry. A lot of the conversations through the conference and District 7 was also just be aware of the regulations coming out and the directions as to how we'll be able to utilize those funds. Because you don't want the feds to come back in a couple of years and say you didn't use these right. House subcommittee is talking about reducing the budget, but that apparently is just negotiation right now. So money coming back to the county is a suggestion out of committee is to reduce it from 2% to 1%. So we're hoping that doesn't happen. Ag and tourism talked about the waste management plan. They're going to want all the counties to update their waste management plans and suggesting that they do that in agreement with other counties. Apparently waste management plans haven't been updated in 20 plus years. But if you do with other counties, then there may be money trickling down through the state to help with whatever suggestions come from that. The revenue sharing base was cut in 2004. So that was the motion that we also the resolution we just passed to potentially recover $804,000. And the total number sitting out there for counties is 117 million. So we're hoping that the state allows that to happen. And then the 4-year terms that we just talked about as well. MAC obviously is supporting that quite extensively. It did come out of committee, so that's a good sign. So that means it may make an actual bill on the floor, but it seems the resistance is coming from former commissioners who are now representatives. And then when they get term limited, they want to come back and be a commissioner again. And if the commissioners are there for 4 years and then they're term limited, they won't have anywhere to go. So there's a little political push, not a large percentage of them, but enough that are saying, hey, we might not want to do this. But we think now that through MAC that there's enough support to potentially carry that, whether it's good or bad. But in any event, it's something that's finally being considered and made it out of committee. So in all those meetings and all the Zoom context, that's my short presentation.
Thank you. Good presentation, a good report. Thank you, Bill. John, anything from you?
Sure. So we had the Board of Health met, not last week, but the week before. And then I asked Director Wilkie for an update, which he gave me one on the current status of where we're at with COVID issues in the county. So I'll give you guys that update now. Obviously, April was a very high month for us for cases. We were hit hard by the UK variant, is what he's telling me in this email. And then as of today, or May 4th, we're at a positivity rate of 20.6%. Michigan as a whole is at 12.3%. So that indicates that we are still at a slightly elevated level compared to the rest of the state. Unfortunately, we have also experienced additional deaths during April in age brackets that were not seen before. Several in the age category of 35 to 77 years of age due to COVID-19 related illnesses. The total death as of today in Sanilac County was 97. And then moving on to a lighter note of the vaccines, 32%, which is 10,957 people have their first and second dose combined in the county. And then we have 39% at least one dose. And so the Johnson & Johnson vaccine that was on a pause is coming back into use. So the county is using the Moderna, the Pfizer, and the Johnson & Johnson. And the health department now, because I think the shift in the attitude towards the vaccine is the people that really wanted it have been served. Now they're going to try to make it more convenient to see if they can get more buy-in on it. So be on the lookout for potential pop-up clinics and ways of making it more convenient for residents that want to get the vaccination to get it. So
That's readily available now.
yes, that's kind of the understanding that I have.
I've heard the same thing.
And then beyond that, the Salem County Medical Control met last week, great meeting. One thing to be aware of, we are starting to have a hard time finding providers in the county. So getting new people into the programs, into the training sessions and retaining people is an issue. It's not a catastrophic issue right now, but if this trend continues, we just don't want to end up in a situation that somebody calls 911 in Salem County and there's nobody to respond to the call. So it's something for everybody to keep in mind. So beyond that, that's all I had.
Thank you, Commissioner Block. Okay, moving on, in our agenda is new business, and at this time, we'll start with FA 075-21. Current claims.
The Salem County Board of Commissioners hereby approves the payment of current claims for 2021 identified on the accounts payable report dated April 27th, 2021 for the general bank account in the amount of $50,437.73.
Given a motion support for current claim 2021, any discussion, any questions? Hearing none, all in favor say aye.
Aye.
All opposed, the same, motion passed. Next, FA 076-21, budget adoptions, amendments, appropriations, and transfers.
Salem County Board of Commissioners hereby approves following budget amendments, transfers, and establishes the following accounts as listed.
Entertain the support for that. Okay, the motion made and support for budget appropriation amendments. Any further discussion, questions? Hearing none, all in favor say aye.
Aye.
All opposed, the same, motion passed. Moving on to page 4, next one is FA 077-21, authorization to post and fill electrical inspector position for construction of land use.
The Salem County Board of Commissioners hereby authorizes the Construction and Land Use Office to post and fill the electrical inspector position at a pay grade 10.
Support.
And a motion and support for authorize land office fill the electrical inspection position. Any questions? Hearing none, all in favor say aye.
Aye.
All opposed, the same, motion passed. Next is FA 078-21, authorization for wage increase for temporary part-time Marine Patrol deputy.
The Salem County Board of Commissioners hereby authorizes increasing the rate of pay for the temporary part-time seasonal Marine Patrol deputy from $12 to $15 per an hour, and to further authorize the position to be evaluated by municipal consulting.
I'm entertaining support for that.
Support.
There's been a motion made and support for authorization for wage increase for temporary part-time Marine Patrol deputy by the Sheriff's Office. Any questions? All in favor, say aye.
Aye.
All opposed, the same. Motion passed. Next is FA 079-21, authorization for classification study for the recycling center.
The Salem County Board of Commissioners hereby authorizes the recycling center attendant, sorter, and coordinating positions be evaluated by municipal consulting.
Support.
Okay, been a motion made in support for a study done for classification for the recycle center. Any questions, comments? Seeing none, all in favor say aye.
Aye.
All opposed, the same. Motion passed. Next is FA 080-21, authorization to post and fill animal control census position, animal control department.
The Salem County Board of Commissioners hereby authorizes filling the seasonal census position at an hourly rate of $10, and further authorizes the animal control census position be evaluated by municipal consulting.
Support.
Okay, then a motion made in support. Any further questions? Seeing none, all in favor say aye.
Aye.
All opposed, the same. Motion passed. Next is FA 081-21, authorization for wage increase, elected officials, Board of Commissioners.
The Salem County Board of Commissioners hereby authorizes effective July 1st, 2021, a 1.75% increase for elected officials with revised 21 wages as follows. Treasurer, $62,023.92. Drain Commissioner, $56,566.76. Prosecutor, $101,814.06. Register of Deeds, $59,433.19. Clerk, $62,948.88. Sheriff, $78,256.51. Board of Commissioner Chairman, $10,755.79. Board of Commissioner Vice Chairman, $10,042.82. Board of Commissioners, $9,503.22.
Entertain support for that motion. Support. There's been a motion made in support for authorization for wage increase. Any further discussion? All in favor, say aye.
Aye.
Opposed, same, motion passed. FA 082-21. Approval of subrecipient agreement with the I-69 Development Corporation.
The Sanilac County Board of Commissioners hereby approves the subrecipient agreement with the I-69 Development Corporation for the purpose of allowing qualified Sanilac County businesses apply for loans through the Michigan Community Development Block Grant Program, and further authorizes the board chairman to sign necessary documents. Support.
Okay, there's been motion made and support. Any further discussion? All in favor, say aye.
Aye.
All opposed, the same. Motion passed. We're getting near the end here, Jim. You've had a lot to read today. Next is FA 083-21 award and authorization of seawall construction. Parks Commission.
The Sanilac County Board of Commissioners hereby awards and authorizes the bid to Rickett Transport for the purpose of installing a seawall on a portion of Forester Park shoreline at a cost not to exceed $16,250 with funding from the Parks Millage, non-proton 420.
Support.
And then motion made and supported for the recommendation of the seawall. Any further discussion? All in favor, say aye.
Aye.
All opposed, the same. Motion passed. Next is NFA 022-21, acceptance of the 2020 annual drug task force report by the drug task force.
The Sanilac County Board of Commissioners hereby accepts the 2020 annual drug task force report as presented.
Support.
There's been a motion made in support. Any questions? Any questions for Jim, our director? He's here today. Answer any questions?
Another well-done report.
Yeah, if I can just make a couple of comments,
Sure. Yep.
and I don't like to talk, so. A little off topic first, as Jen touched on it, but I just wanted to give a personal, non-biased comment on the health department with the COVID shots. They did a really good job. We're easy to be critical of other people, but they did a great job. My wife and I are now able to our granddaughter, so that's been a very big plus. In the packet for the report for the year, the word that I want to use is it was just an odd year. Doing drug surveillance, drug arrests, and making those type of workings happen in an environment that we're in. It's nothing like going in and following a drug dealer into a Walmart parking lot and there's nobody parked there, but you and them. So those things have changed. With your support, we got the authorization and our drug dog, canine dog, graduated last Friday and was working Monday. So it's already been out on a couple of cars, already been out on a public relations. So if any of the commissioners in their townships want the dog to come out, you will do a demonstration. Deputy Josh James will be more than happy to do that. And we are going to utilize the newspapers to get a little bit of good publicity for that. I think it's going to be extremely helpful to us. One of the pictures that I put in the report was just a picture of a penny. That's 1 gram, and most of our meth quantities that we're getting is a half a gram at a time. So for a person to find that is so difficult, and that dog hits on it just immediately. It's absolutely amazing. So we're hoping that'll help us out. We did get our prep radios that were approved last August. Due to COVID, that was set back about 6 months to get those programmed. The guys can utilize a prep in their office or anywhere in the car. We can talk to Thumb Narcotics in Tuscola. We can talk to St. Clair County Sheriff Department. We can talk back to our own dispatch, and we can talk to Grand County directly. So the radios are working at this current time amazingly. At some point here, we've got a patrol car for that K9 deputy to drive. We're probably gonna come back with a couple of bids for a hard radio that'll go and mount right in the patrol car and stay there. He also has a prep that was issued when Josh Horst, Deputy Horst, was the K9 officer with the bomb dog. So he does have a prep, so we've got preps at the office. I think a hard radio coming out of our contingency will work. So just keep in mind the quantities, everything we've had, 7 out of 8 cases are meth. Small quantities, they make multiple trips daily. So it's an issue that's confronting us. We're not alone in it. They're going down to the cities to get that. I think the most we get at one time is 7 grams up in Deckerville from a home. For some reason, the COVID year, pills dropped way down. Vape times probably due to the schools, not, being virtual, dropped to almost non-existent. We have some issues with, not personal marijuana growth, but caregiver rental growth in the county. There's some townships and cities that are trying to address that. We have no way to tell whether a caregiver that's living in our county has 10 more pieces of property throughout the state, and they're doing multiple things. That's an issue we're working with the feds on, and we're also working with the 3rd District of the State Police, person that's in charge of the marijuana and tobacco. Individually, it has not been a big issue this last year at all.
Do you foresee any type of enforcement regulations coming forward to allow you to monitor those facilities?
We have a right to go into the caregiver facilities, but what they're doing is they're taking a building and they're running out spots inside the building in which they say they don't have control over. The problem becomes is that caregiver doesn't necessarily live at that address and may live somewhere else, and he may be doing that in 10 other spots. There's no way to verify that with the state. Personally, it was probably written that way to be difficult for law enforcement. But it hasn't been a major problem individually with people around the county. So those there's some concerns over in the southwest part of our county. North of here, there's some concerns. There's factions buying up large farmland property, and they're growing on there. Whatever's legal, we'll support that. Whatever's not, it's actually going to cause probably some issues for the people that legally have licenses to do that.
Yeah, every meeting I've been in with my townships, commercial grow is a big thing, how to regulate it. I think we've all heard the same thing.
Right.
Every township meeting. Yeah.
And it's the under the door issues where they're doing the guise of being caregivers. And they're growing the plants. So we had one in Marlette where we went in, where the gentleman was actually accused of holding someone hostage. And it was one faction trying to flip the other one. And there was like 1,500 plants in there. Now, one caregiver, obviously 72 plants. We started removing some of the plants without charging anyone. And they wanted to selectively tell us which were the worst plants to take. And it's a commercial warning. I'm not sure how to address that, other than we probably need a little help on the state level. If they could regulate that better, I would say that the legal growers would probably appreciate that.
Question, what meth is obviously a big issue here everywhere, especially in our county. Over, would say the last 24 months, how much of an increase has meth become over the last 24 to 12 to 24 months?
100%.
100%.
Right. Probably 2 years ago, maybe 2 out of 10 cases. Now it's 7 out of 8.
Oh my gosh.
We also have an officer that's going in off of that topic that made me think of it is we do a lot of cell phone seizures and glean information off of that. And we assist all the other agencies in the county. We have one officer that was scheduled to go last April to Alabama for federal school for cell phone extraction, all paid for by the federal government, plus about $30,000 worth of equipment. That has been rescheduled. He goes in June. That's a 4-week course. We need people like a flight back and maybe a rental car down there, but everything else is paid for we'll still have the equipment, which will be a big help to us, plus other criminal investigations.
Any questions for Jim? Jim, thank you so much.
Okay. And the only other thing you want to keep in mind is the money that we got to start the dog came from some of our savings that we created by, one, me not taking benefits, two, by some grants that we established, three, there was some kickback during the COVID time when we had some of the officers went over to the sheriff department and worked. That money can be utilized for that, and we still have probably coming July, August, I got with the county administrator, told her that we probably submit, we have not transferred that money yet over for this year. I want to be a little more sure and do it one time. And I think pretty shortly next month, the carryover balance will be solidified, I guess is a good word.
It should, it depends on the audit. So we're kind of waiting on the auditors right now. I know there's some CARES Act funding, that some regulations and rules that they're waiting on to do the single audit.
Right. So don't be surprised if you see that transfer that I haven't done yet, the request come over for that. We'll be able to better figure out how much money we need to pay for that K-9 officer for the rest of the year. There will be money to transfer over if we're going to do the 22 budget. To carry it over into next year. It won't finish up through the new millage. So at some point, there's going to have to be some decisions made on what you want to do, whether it's eliminating my position. This is, supplant that with the officer, whether that's to do away with some of the programs that are there. But we need to look at doing that, even if it didn't take effect until partway into the new millage. I think our millage would come up on next August. So hopefully we got this short window of time to show you exactly what the dog and the canine officer can do. And so far, I'm very impressed with them.
Great.
Thank you.
Thank you. Okay, seeing no more questions, all in favor, say aye.
Aye.
All opposed, the same, motion passed. We have one more. As we said earlier in the meeting, we had one addition, and that's going to be NFA 023-21. It's on the pink sheet in front of you.
County Board of Commissioners hereby authorizes offering effective July 1st, 2021, 3 self-funded Aetna health plans through Pareto Health and for active employees and non-Medicare eligible retirees. There's going to be a $250 deductible plan, a $2,000 deductible plan, health savings account, $3,300 deductible plan with an employer funded deposit paid in quarterly installments. Further authorizes effective July 1, 2021, revised employee premium contributions in compliance with the hard cap limits set by the Michigan Department of Treasury of $7,043.89 for single person coverage, $14,730.96 for double coverage, $19,210.66 for family coverage. Further authorizes Medicare eligible retirees remain on the Humana Pro Medicare Advantage $0 deductible plan through December 31st, 21, with revised premium contribution rates beginning July 1st, 21. Further authorizes effective July 1, 21, a self-funded dental plan through Delta Dental for coverage period of July 1, 21 through June 30th, 22.
Thank you, John. I'll have to ask for a support. Support. Okay. The motion made in support for authorization of health, dental, and vision dental recommendation. At this time, I'll open up for discussion or questions. Seeing none, all in favor, say aye.
Aye.
All opposed, the same. Motion passed. Next on our agenda is public comments. Do we have any public comments this time? Okay. Before we have anyone come to the podium to speak, our rules by the Board of Commissioners is 3 minutes and one topic.
Thank you very much. For the record, my name is Kim Corey. Good afternoon, and thank you very much for allowing me to speak today. I come to you all with disturbing facts in relationship to a sincere email that I sent containing a peer-reviewed study of safety, dangers, and efficacy of face masks. My email was addressed to all Sanilac County School Districts, the Board of Commissioners, and copied to Michael Smith, founder of WeTheCounty.org, and Andrew Beeler, our state representative, with the plea to remove masks from our kids in schools and daycare centers. There was an attached PDF file with this corresponding link directing receivers of the email to the source of the study, which came from the official website of PubMed Central, also known as PMC. The study was published in November 2020, updated again in January 2021, and remains available for reference today. PMC is a free full-text archive of biomedical and life sciences journal literature at the U.S. National Institutes of Health, National Library of Medicine. The National Institute of Health is the primary agency of the United States government responsible for biomedical and public health research. It is part of the United States Department of Health and Human Services, the agency who is now unilaterally initiating orders under COVID-19. The article comes from the United States National Library of Medicine. In brief, in my experience as a certified occupational safety specialist, I often conducted research for my work using a similar organization called NIOSH. NIOSH is the National Institute of Occupational Safety and Health, a federal agency responsible for conducting research and making recommendations for the prevention of work-related injury and illnesses. The same organization that facilitates respiratory protection, mask research, and recommendation on occupational settings. The same organization that OSHA references when proposing regulatory rules and standards. I hope you all see where I'm going with this, but I'll move on. At some point, my email was forwarded to Medical Director, Dr. Mark Hammett, who responded to everyone in such an inappropriate manner that I felt it necessary to bring to public today. Dr. Hammett claimed that my email was fascinating, finding that the article was not scientifically fact-checked, even requesting that I respond back to address all of the criticisms easily found online about it. He later went on to claim the article was debunked many times over and not peer-reviewed. I strongly disagree. He shared an article coming from PolitiFact.com, which if you Google it, it's an American nonprofit project operated by Poynter Institute in St. Petersburg, Florida, that began in 2007 as a project of the Tampa Bay Times with reporters and editors from the newspaper and its affiliated news media partners reporting on the accuracy of statements made by elected officials, candidates, their staffs, lobbyists, interest groups, and others involved in U.S. politics. Now I ask a very important question. What kind of licensed physician uses the mainstream media to debunk peer-reviewed science coming from the National Institute of Health? I'll just leave that right there. There is more that I will.
Mrs. Corey, your time is up. Your time is up.
My time is up. Okay.
Chairman, I'd like to move to request that Ms. Corey be allowed to finish her statement for an extension of 2 more minutes, please.
Okay.
Ms. Corey, would you like to take advantage of that?
Yes, absolutely. Thank you. Would like to.
Go ahead.
Okay. I'm just gonna find out where I was at, okay? There is more that I won't go into. My hope is that you'll address the inappropriate behavior of Dr. Mark Hammett, as he's clearly demonstrated that he is a bully with a complete lack of openness to addressing factual public concerns. While I will admit that some of my responses to him were a bit aggressive, however, in his position, he must absolutely be open to considering each and every citizen concerned, no matter what it is or who they are, especially now when we are all being mandated to do things that are detrimental to our health and safety. I will emphasize that the information that I shared was peer-reviewed and factual, and by no means considered misinformation, as Dr. Hammett had suggested. I will also ask that everyone be open to the information I shared and make informed decisions appropriately. In reference, America's Frontline Doctors is a union of well over 80,000 licensed physicians around the world who have banded together to fight misinformation relating to the COVID-19 pandemic. I highly recommend that folks visit the website at .org. This is not about you. This is not about me. This is not about us. It's about our community. We are absolutely owe it to everyone to be proactive, reactive, and diligent in the decisions we all make when it affects our kids and our citizens. The misconception of wearing masks to prevent a virus is very real. And I can understand why folks are confused. In my opinion, though, masks coupled with many other factors are doing just the opposite of its intended purpose, if the intention is in fact to save lives. They are, in fact, making people sick. Our babies and K-12 kids need us right now. It should be about protecting them. It is absolutely not in their best interest to wear face coverings while they are exerting during sports or practice. Our 2 to 4-year-olds, while their tiny brains are still in development, should not be limiting their oxygen intake through a mask. It is preposterous to believe that it is okay for a small child, even if for the greater good of appearance, which is what this is. No amount of money in the world can justify this travesty against them. With that, I thank you very much for allowing me to speak here today.
Thank you very much. Thank you for coming in.
I better get up here fast. I only got 3 minutes, right? I can read fast. Can you listen fast? I only have 1 page. I want to thank everybody so much for allowing us to come and have in-person meetings at this time. I know it's difficult. You guys have a difficult job, and I appreciate the effort that you all put forth. My name is Michael Dennis Smith. I live in Sandusky. I'm the founder of We the County, which is a county-by-county grassroots organization standing up with small businesses, patriots, and churches to protect our constitutional rights. When a person goes to their doctor, they're given a serious life-threatening prognosis. Most people will get a second opinion from another doctor. Many times the second opinion is contrary to the first opinion that they were given, but then the patient has to decide what's best for their medical interest for their own body. Unfortunately, with COVID-19, we do not get a second opinion. There's only one narrative and one opinion allowed. When medical professionals stand up with a second opinion, they are vilified, attacked, discredited, intimidated, and removed from social media platforms and stamped with a fact check. This seems to be what happened when Dr. Mark Hammond discredited the medical information presented by Kim Corey. It did not line up with his narrative. Fortunately, millions of citizens are realizing the numbers and the medical science given to us by our government officials and health agencies are not adding up. They are listening to the doctors who have worked with tens of thousands of patients with COVID-19 and have treated them successfully with medications and things that the government has actually frowned on. There are thousands of highly qualified medical professionals that have a second opinion. People are starting to ask questions. Why did our governor place COVID-infected patients back in with the most vulnerable of our population, our nursing homes? Why did Michigan, a state with a very strict lockdown regulation, just go through another COVID surge, and states like Florida that did not have as strict regulations fare much better? What happened to influenza A and B? Did it really just disappear? If hundreds of thousands of people died from COVID in 2020, why is the death toll rate in America for 2019 almost the same as 2020? Many believe the number one thing we can do to fight against COVID is to strengthen our immune system. Why have we heard very little from our government and health agencies about strengthening our immune system? Sanilac Board of Commissioners, if you make decisions based only on one medical narrative, one which is questionable at times, are you being negligent, incompetent, naive, or being forced to go with the flow and not make any waves? If you or your loved ones were diagnosed with terminal cancer and given 3 months to live, would you get a second opinion? So don't we all deserve a second opinion? So I hope when you make the decisions that you make, you just don't take one narrative, but you look at the larger perspective. Thank you for allowing me this time.
Thank you.
I just want to give you guys a copy of that.
Thank you. Thank you, Mike.
Thank you. Appreciate your time. I appreciate all you guys do. You need one of these? You do?
Thank you.
Thank you. you for your time. I appreciate all your work very much.
Hi, thank you for allowing me this time. My name's Sharon Bujak. I am a truth seeker because that's really important to me because we're gonna live in truth no matter what it is. So I want to always know truth. Last summer through fall, I was a circulator for the Restore Freedom petition, which allowed me to speak with a lot of people. I got over 500 signatures myself. So I had a lot of interaction with people. These are some of the things that I learned. I actually spoke with many nurses and doctors, and many of them were very upset about the issues, health issues that would arise from wearing the masks for any length of time. One in particular was a mother, and she had a couple of young boys, and she was livid. She said, I know what that's going to do to the children, and I'm very angry and upset about it. They told me that it was going to produce many health issues up to and including lung cancer eventually. It's not going to be good. Different complaints I heard personally from people where they were having problems with headaches, fatigue, poor concentration, lung infection, dizziness, difficulty breathing, and panic attacks. People told me they had loved ones that had passed away. There were falsifications on the death certificates that stated COVID, and they were clearly not. And they were having to take it to court and fight to get that changed. Because some of them involved life insurance policies. So it was important that the information be accurate. I heard of suicides. I had a dad tell me about his daughter who had been on drugs. She went to rehab, was doing really well, was back to work. And then the lockdown forced her to not have any more meetings that she could attend, and she got back into the drugs. They were heartbroken. She had children that they were helping to raise. I spoke with legal immigrants that fled communism. I was told these are just some of the things I was told, but the general population all rented homes. They couldn't afford to own one. Very few owned a vehicle. Most of them rode bicycles. One woman that moved over here from Romania, she and her husband did own a vehicle. They tried to sell it before they came to the United States, and they couldn't. So they left it in a parking lot with the keys and the title inside the vehicle. They just had to leave it. Speaking out against the government in these countries lands them in prison. Prison life has horrific conditions. There are beatings, starvation, there's sexual abuse. There's even organ harvesting. You, in communism, you're viewed as a commodity, not a human being that's valued. You're just like cattle. They do what they want with you. In addition to being sent to prison, I had one gentleman tell me that if you speak out against the government, not only are you sent to prison, but they punish the entire family by dispersing them from one another. He told me, and I don't use vulgarities, but I'm going to tell you the truth. He said to me, everything there was free and everything was shitty. I don't use that kind of language, but I want you to get the drift. I want you to understand the reality. I know a gal, I just spoke with her recently.
Sharon, your time is up. I'll give you another 30 seconds to finish up.
Okay. Please do what we hired you guys to do. Please fight for our freedoms and our rights. Don't allow us to go into communism. We need to establish things at a county level that are gonna save and preserve our freedoms and our rights, because not one of us will be happy living in communism, and shame on us for allowing that to happen to our children and grandchildren. So I don't have much more. I wish I could tell you, but if I can't, please fight for our freedoms. Please preserve them. And I appreciate, I know you're in a tough spot, but we all have to make hard choices, make the right hard choice.
Thank you,
Okay.
Sharon, and thank all three of you for coming in and sharing.
And I would.
Appreciate you coming in, being part of our meeting, and Yeah,
Could I please hand you a pamphlet?
sure.
It is from We the County. If you go onto the website, there's great educational information that you can access and learn from. It is a wonderful source.
Thank you.
Thank you so much.
I also made a copy of.
Yes, thank you.
Is there anybody?
Thank you.
that wants a copy of that?
Thank you.
I'll do them for you.
Thank you.
Thank
So I can email. Would you like a copy?
Thank you. Thank you so much.
Moving on, there's no reading for closed session today or approval of closed session meetings. And so I'll ask for adjournment. Let me.
I got one thing to say. I also got my shots the same day Jim and his wife did. And finally get to go see my mother Saturday. First time in over a year.
Oh, good.
Wow.
Good.
She just turned 97, the 14th of April.
Yeah, that's too bad. That's, yeah. Okay, thank you. So moved. Okay, motion to being supported by Commissioner Webb. Any further discussion? All in favor, say aye.
All right.